I was very excited to speak about this because I love learning new topics and especially new areas of science and all that, and just expanding the knowledge. And the more I've talked to different fields or disciplines in science, there's always a connection between between some field and another field, and between it all.
This production was recorded at the podcast studios in the Media Arts Centre at Murdoch University. The views and opinions expressed in this podcast are solely those of the hosts and guests and do not necessarily reflect the official policy or position of Murdoch University. Any content provided by the hosts and guests are their personal opinions and are not intended to represent the views or opinions of the university, its administration, faculty, or staff. Now we have that out of the way, let's talk science. Paramount importance.
I do want to start by having a little disclaimer, just for the audience to let them know that I just want to note that this episode is grounded in science, education, and curiosity. The questions asked are not of personal experience, but are designed to help listeners better understand the science of sex, relationships, and the human connection. This is about awareness, not sensationalism. But thank you so much for joining me today.
Great, thanks for having me.
My first question is, what is a sexologist?
Well, I think most people, when they come to see a sexologist, they imagine that I'm going to be Barbara Streisand out of Meet the Fockers. And I probably do look a bit like Barbara Streisand. Or the lady on, Gillian Anderson on sexual education.
Right, yeah.
People always imagine that. And I'm sure there are sexologists out there like that, but that's certainly not what I do. So a sexologist is usually either a psychologist originally that then goes on and becomes a sexologist by doing a master's, or someone who is in the health professional field. So a social worker, a nurse, a doctor, a specialist, whatever. So my background is I'm a nurse practitioner, and then I did a sexology qualification postgrad. And so basically a sexologist helps people with either their physical and psychological sexual wellbeing. So it can be that you're discussing physical sexual problems like dry vaginas and erectile dysfunction and, diseases or medications you've taken that have affected your sexual libido and things like that. But it can also be the more psychology side of it, where you're talking to someone about why their libido is low, or why they feel icky about certain subjects, or, why they're not attracted to certain people, or whether they feel confused about their gender. So there's different areas of sexology.
Is it a relatively new science and subject? Because love, passion, sex is it's the biggest thing in the world. Everyone has it.
Mm-hmm.
But we haven't really studied it or talked about it that much relatively. It's usually always kept a bit quiet.
I think that's a real Australian thing.
Right.
That it's quite, because if you think about it, most religions in, Eastern countries have phallic symbols, as, you go to, Indonesia or India or wherever, and there's, naked gods and phallic symbols everywhere. And the ancient Greeks clearly talked about their sex life quite openly. And the Europeans are obviously much more, not so worried about nudity as we are. So I think it's a bit of a British Australian hang up. So one of the probably world's most well-known sexologists is a lady called Betty Dobson, and she only died last year in her late 90s, and she was still writing books and talking about sex.
Oh, really?
So I feel like it's a bit of a hangover for us from the Brits of it all being very proper.
It does make sense. Yeah. What got you into sexology?
Well, I was originally a nurse, and I did a lot of rural and remote area nursing. So I worked in the Abrolhos Islands and Cocos and Christmas Islands and some Indigenous communities. And then I became a nurse practitioner in 2003, so a long time ago now. And then I went into general practice in Geraldton, a country town in WA. And I was the only female practitioner there. The rest were all male GPs. And I found that a lot of people would just come in and start chatting to me about their sex life. And, they'd need a pap smear or whatever, and they would just start talking about it. And I didn't know much about it myself. And then one day in particular, a lady came in who was in her 60s, and then I was I was probably about 40. And she came in and she was coming in for a pap smear, and I went to put the speculum in and take it, and she had a very dry, painful vagina. And I remembered her well because when I was a new grad out of uni, I'd worked in an emergency department with her, and I was 22. And she used to come to work on night shift and tell me about her amazing sex life. And she was in her 40s then. And I was disgusted that someone that old was still having sex. And I think I was just like, obviously by the time I saw her again, I was 40 myself, and I realised that it was pretty normal for a 40-year-old to be having sex. And I was shocked that she had let this vaginal atrophy get so bad because, you know, she'd gone from being someone who was quite a sexual being and obviously enjoyed her intimate relationship with her partner to someone who had let this happen. So I asked her about it and said, why aren't you doing something about this? We could fix this. And she burst into tears and said her husband had had his prostate removed 2 years before and their whole relationship had broken down. He was depressed, miserable. He wouldn't hold her hand. They fought all the time. They'd completely stopped communicating. And so we finished the pap smear, which is now called a cervical screen. And I sat her down and we chatted about it. And I was like, I didn't know anything about this area then. I was definitely a generalist. I'm also a midwife, so I'd been looking after like family health. And she just said, look, there's nothing. The GP gave us some Viagra, it doesn't work, and he's just got increasingly depressed. And I was like, that just doesn't make any sense. There's so much more to sex than penetrative sex anyway. So what about all the other things? And have you tried to tell him that, you know, this is making you really sad and you miss being close? And she said, I've tried, he just won't talk to me. So I said to her, do you think he'll come in and see me? And he did. And I really was flying blind. I had zero idea what I was doing. And he came in and I just said, you know, he was taking antidepressants. And I said, you know, your wife is just so sad that you're not connecting and that you're totally disconnected. And he said, I just feel like I'm not a man. I'm so ashamed. I would never have had my prostate out. If I had have known this was the outcome, I would have preferred to die with prostate cancer. And I feel like it's like going window shopping. Like I can't finish the job. If I show her any affection, then it's just not fair. And so I ended up getting her back in as well, and we had a 3-way conversation. And I said, I'm sure there's something we can do to help you. I'm going to go and find out. But in the meantime, can you just make an effort to have an open conversation, hold hands, just try and reconnect, and don't worry about sex. Like that's a tiny part of don't worry about penetrative sex. So, and I also said, when you tried the Viagra just out of interest, did your GP tell you that you have to take it on an empty stomach and you have to wait an hour? And he goes, no, I just took it and expected it to go up like it does in the movies. And I was like, oh no, you have to take it on an empty stomach and you have to wait an hour. So in the meantime, I rang the guy, this doctor called Stephen Adams, who ended up being my mentor. And I knew he worked in this field in Perth, and I asked him if I could come and spend some time in his clinic. And then I told them to come back 3 weeks later and I'd see what I had found out. So 3 weeks later, they sat in my clinic holding hands and giggling and said, we failed our homework. We took a Viagra yesterday and we had sex. And they were like just so happy about that. And I'd gone off and I learnt all these exciting things about injections and penile rehabilitation and never got to use it really with them. Mm-hmm. But they were so grateful. And a week or so later, I got some flowers sent to the clinic with a letter just saying, thank you so much. Like, we've really reconnected and like, we're so much happier and like, we just can't thank you enough. And so I went home that night and said to my husband, who'd already sat through me being a university student numerous times, and said, I want to go and study sexology. And he was like, that sounds really great. I'd love to tell people I'm married to a sexologist rather than a nurse. He reckons it was great cred for him. And so I went back to uni.
Right.
And that's how I got here.
I was told that a lot of sexologists have got some really interesting stories, and that was by far, it was really interesting. We touched on people with prostate cancer and depression, and then like a sex life changing. That's really common with people that have prostate cancer, isn't it? Like, yes. And a lot of people end up super depressed. What happens when people have prostate cancer? So
I think there's a real misconception. It used to be that if you had prostate cancer treatment, radiation or surgery, you would end up impotent, so you couldn't get an erection. And that was kind of it. I think medicine feels like we can fix the problem, but we don't often think about the quality of life after. And, you know, nowadays, so prostate cancer has been curable for many years now. But I think a lot of men avoid getting tested because there's still this urban myth that that's it, that's the end of your intimate life. And that just isn't the case. The treatments have come a very long way. Many men go back to their pre-surgery function within the 2 years following now with rehabilitation. And even with radiation, it's much more like targeted, so they don't necessarily lose their function anymore. And also there's all these workarounds. So the reason a man does lose his potency is because the nerves that are around the outside of the prostate are the nerves that tell your penis to get erect. And if they're not working, then you can't get an erection. And so they need help to get working again. So you need penile rehabilitation and things like that. So the way I explain it to patients is, and if there's any health professionals listening, this is a patient explanation, not a scientific explanation, but I think of the nerves that tell your penis to get erect as an electric cord going to a kettle. And if the electric cord was frayed, so the power source is your libido, your desire to have sex, your penis is the kettle and the electric cord is those nerves. If that cord is frayed, you'll get a lukewarm kettle, but you can't boil it. If you went out to the shed and got some electric tape and wrapped it around it, then you could seal the electric cord and suddenly you can boil the kettle again. That's how tablets like Viagra, Cialis, those things work, is like electric tape.
Right. So when you say penile rehabilitation, what is that? That's not just adding tablets and medication?
No, not at all. So the other thing is that, and then on top, if we go back to the electric cord, if that is too frayed and it doesn't work at all with the tablets, or there's now a fantastic nasal spray out for erectile dysfunction that works amazing called Spontan that's only been around for about a year. But if those things don't work, then that means the electric cord's completely stuffed. So then you would put it on a gas stove to get your boiling water. Well, the opportunity for this situation is you would use an injection into your penis, which sounds terrible, but it honestly does not hurt. And we have thousands of men in our clinic that do this. And most people would know someone who does it, but they just wouldn't tell them. You don't feel anything. And there's a video on my YouTube of doing it if anyone wants to see that. Sorry, but I lost the question. Oh, the penile rehabilitation is that a healthy man should have 3 to 5 erections every night while he's asleep. So when you're sleeping at night time, you should be getting an erection. And as a young guy, hopefully it's a really good one and it's poking your partner in the back if you have a partner. But as an older guy, it might just be a bit of a semi. But your penis is made of smooth muscle, and all muscles need to be exercised and stretched and lengthened to keep them healthy. And so if you're not having those spontaneous erections, which you're not after you've had prostate cancer treatment, or if you've got diabetes, or if you're overweight, or just from aging and all the reasons why things go downhill, then you need to do it for it. Just the same as if you had a paralysed arm, you would go to a physio and do exercise. So we teach men to do penile rehabilitation, which is using a penis pump and taking a low-dose PDE5 medication like tadalafil, which improves the blood flow. And what that does is it keeps the penis from shrinking and keeps it healthy.
Right. So what's a penis pump? I'm sure it's sort of in the words itself, but does they have to do that every night or like before bed or during the bed, during the sleep, or is it automatically?
No, so the idea is that you would do it, replicate nature. So if you think that you should be you're a 50-year-old bloke, you should probably having 3 to 5 erections when you're asleep, but you know that you're not. And
how do you know when you?
Well, that's a really good question, and I've got something to show you that can check that.
Right. Okay.
So if you've had prostate cancer treatment or bladder cancer treatment or colorectal surgery for bowel cancer, you pretty much know there's going to be a period of time where you're not going to be getting nocturnal erections. And also certain medications like blood pressure tablets, opioid pain relief, antidepressants can stop you from having.
What about stress?
Stress, definitely. And being overweight, definitely, which I can talk about more. So if you know you're not having nocturnal erections, and often the first sign is you're not waking up ever with a morning wood anymore, then you would come and see someone like us and we would help you. We'd show you how to use a penis pump. And so the idea is you replicate nature. So if you should be having 3 to 5 a night, you would just pump it up, hold it for a minute, let it down 3 to 5 times, 5 days a week, and you're keeping it healthy just the same as if you were going to the gym.
Yeah, right. Okay.
But I'll show you this. So this is an American invention by a doctor, and it's called, for anyone's listening and not watching, it's called a Firmtech, but it's I call it a Fitbit for your dick.
Okay.
So what happens, and I didn't bring Jeffrey, my penis. I've got a penis called Jeffrey, but if you watch YouTube, you can meet Jeffrey. Your testicles or your scrotum goes through here. And then that just goes around the shaft, and then your penis is through like that. And this is a tech bit.
Okay.
And then it connects to your phone, and in the morning. So
people listening, this is sort of a silicon-based sort of big lucky band, then with a small.
It's just a tech piece.
Yeah, a tech piece that's probably around the size
It's about 2 centimetres by 1.
Yeah, 2 centimetres by 1.
They're surprisingly comfortable. So my husband has to try out everything we ever get on the patients to use. So if you have a penis, be assured that he's tried it first. Sometimes my son has to try them. But you wear it at night time while you're asleep. Then when you wake up in the morning, you press your phone and it goes back to an app and it gives you a reading of how many erections you've had that night.
Right.
So it's great to know, like when you're doing penile rehabilitation, at some stage in the journey, you'll usually start getting nocturnal erections again. And you're probably a bit sick of using a pump every day, you get sick of doing everything else. And so this is a good way to go, I don't have to do it anymore. I'm back getting my erections again. Or like I will often recommend these to younger guys who might have been put on a medication for whatever reason and they think the medication has negatively affected their sexual function. And so the way we know is we'll check while you're asleep with one of these to see whether things are actually happening or not. And also it's a good way to figure out if you've got erectile dysfunction or premature ejaculation, particularly erectile dysfunction, if it's all, often GPs will tell their patients it's all in your head. You just need to relax, but you can't unthink it once you're anxious and nervous about something. But this is a good way to know whether or not it's a physiological problem or a psychological problem, because if it's a physiological problem, you won't be having nocturnal erections anymore. And if it's a psychological problem, you'll be having normal nocturnal erections, but you just can't get them to work when you're trying to.
So, without the equipment, is there a way to know that maybe something's going on, or like why would, like, say, a young person want to test out they've got this? Is there like ways that they start seeing their body changes or the way they feel about certain things? Or
Definitely. So for a young guy, the question I would always ask a young man when they would come in, are you waking up in the morning with morning wood? So, most young men are. And if you've noticed that that's not, and then often they've never even thought about it. And they're like, actually, no, I haven't been. And so then you'll go, okay, something's going on. Or they might find that they can maintain an erection when they're on their own, but not when they're with a partner. So something's going on. In the old days when we had stamps that, you used to have the stamps that would have perforations and, to post your mails and they would join together. You're probably too young for that. But we used to have stamps in the old days that were like, not on that you peel off, but like postage stamps that were perforated. And we used to get men to buy a, line of them and then put them around the base of their penis, go home, stick it together, go to sleep that night. And if they woke up in the morning and the perforations were broken, we'd go, oh, you probably had a nocturnal erection. Not very scientific, but a good way of getting an idea.
Yeah, it worked.
Yeah, until now. So these have only been around a couple of years. Before that, if we really wanted objective data like this, we'd have to put people in hospital to do it, to test it. But that's why, I'm really excited about these because it's such a great way of, we can see a man who's on blood pressure tablets that thinks that's affecting it and we can actually work it out and then send him back to his cardiologist or his GP and say, look, his sexual function's important to him as well. Can we change to a different drug?
So what changes when they start getting a more healthier penile erections? Is it their sex life improves? Is that the main reason? And then it's like...
Well, I think there's a couple of things. One is if you don't use it, you lose it. So, older men who have lost their erectile function will often have shrinking penises, which makes it hard to stand up to pee and do all those kind of normal things. It's also, I don't have a penis, but I imagine that like if I found out tomorrow I had to have a double mastectomy, that would really affect my view of my femininity. So I think having an appendage that used to work and used to be your best friend and now isn't is pretty sad. So I think it really affects the way you feel about yourself, your self-esteem, your depression scores, how you interact with other people. And
that's why the rates of suicide after prostate cancer is so high, and it's a real problem. What do you think are the most biggest misconceptions people have about sexual health?
I think one of them is that if you have prostate cancer treatment, that's it, you're impotent forever. And I think there's been a lot on the news recently about cases of that. And I think that's so sad that those things happen because they are preventable. And if urologists and medical oncologists just we can't just fix people's cancer. It's the same with breast cancer patients. We need to go, if we can cure people now, we need to make sure that the next 20, 30 years of their life are enjoyable in every way. And intimacy is a big part of that. So, and I think that often we've been so focused on the solution of fixing the disease, we haven't thought enough about making sure people have good quality of life as well.
How important is sex in a relationship?
Everybody's different, so it depends, you know. And I think I think there's a difference between penetrative sex and sexual intimacy. And I think that's the big thing as well, particularly in older generations, and I hope younger generations are different, is that my generation and above often just think sex is penetration, and it's not. And so I think we spend a lot of time in our clinic talking to people about, you know, just being naked together. There's ways to pleasure each other that don't involve an erection. You know, most people don't know that a man can have an orgasm without an erection. So if your erections aren't working at all and you are to stimulate your penis or your partner does, you will have the sensation of an orgasm, and it will feel just as good, if not better, than if you had an erect penis.
Really?
So this is probably the biggest misconception, I think.
I've never heard of that.
Sexual health. Yeah. So you have arousal, and then you get an erection, and then you have an orgasm, and your pelvic floor contracts and it squeezes your prostate and you ejaculate. But you can be aroused and have the pelvic floor contracting and release all those happy, wonderful hormones you get when you have an orgasm and feel the same with a completely flaccid penis and no ejaculation because you don't have a prostate anymore. The ejaculation and the erection are purely about impregnating a woman. They're not at all about the pleasure.
Right.
But you never know that. So every day I would see at least 2 men recently diagnosed with prostate cancer, and they'll often bring their partner in, and I'll say, oh yeah, you won't ejaculate again, but you'll still have the sensation of an orgasm, and many men say it feels better than it ever has before. And they'll go, no, that's not possible. They'll come back a month post-op for their check. And
so is that what they say when they're say shooting blanks?
Yeah.
When they have like the snip to not have kids?
Well, right. when you have the snip of vasectomy, you're still shooting prostate fluid, so it looks the same, but there's no live sperm in it.
Okay.
But when you have your prostate removed, then it just disappears because there is no ejaculate at all anymore.
Right. Okay.
But, yeah. And so if anyone listens to my podcast, The Penis Project, I've interviewed lots and lots of men about this, and they're like, I couldn't believe it, but my orgasm feels better now than it ever did. And the reason that is, I think, and there's a lot of theories on this, but when a man is having to have pelvic surgery, they'll often get sent to a pelvic floor physio and they'll have to get their pelvic floor firmed up. And the stronger your pelvic floor muscles, the more intense your orgasm. And so that's for women and men. And most men have never even knew they had a pelvic floor until this point. So they're doing all these exercises to keep themselves from leaking urine. And then suddenly they go, wow, my orgasm's so amazing.
Right. What sort of exercises are they? Like
Kegel exercises. So our pelvic floor exercises. And so I can give you a very brief explanation of how you do them. But if, please, anyone listening, you want to know about pelvic floor exercises, if you do them wrong, it might make things worse. So you need to learn how to do them properly. But yoga is amazing for your pelvic floor. Pilates is amazing for your pelvic floor strength. And then there's actual exercises. So the way I explain it is if you imagine you've got a piece of string in your mouth, straight down the middle of your body, and it's tied to your perineum, which I think your age group, my son calls a gooch, the bit of skin behind your testicle that goes to your anus. And imagine that you're pulling the piece of string and you're lifting your gooch up.
Right.
Or your nuts to your guts.
Yeah.
Or if you can stand in front of the mirror and wave your penis at it, that's a pelvic floor that's doing it.
Right. Okay.
And you need to do that without engaging your abdominal muscles or your glutes. So it's an internal. You're trying to do it. I can see on your face while you're watching.
No.
It's difficult. It's really difficult. So they're the same exercises that a woman learns how to do when she has a baby.
Right. Okay.
Yeah. And they make a massive difference to your erectile function.
Mm-hmm.
They're great if you've got premature ejaculation to try and control that. And they're amazing to improve the quality of your orgasm.
Right. Is it relatively new, all this kind of science?
No. Pelvic floor has, no.
For males though?
Yeah, no. But
right.
I just think no one knows about it until it happens to them.
Right. Because it's like, I've never heard of any of this before. No. And like, I guess that's probably around that, like, no one really talks too much about, maybe this is just in Australia, as you mentioned, but like sex and all these kind of things, like no one talks about it. It's a very hush-hush topic for – is this just in Australia? I know you said that earlier,
it definitely is in other – Americans and the British are the same. But there is, I don't even know.
Why is it so difficult for society to talk about it?
I think because they're so vulnerable and it's such a personal issue. Like we think of it as such a personal issue. And I also think – and I think this is a bit gender-based as well. Like I think – all women, we go through menopause, perimenopause, we get periods, we have, saggy boobs after we've breastfed, and we usually have a group of female friends that we sit down and talk to about that. But most men don't realise how common sexual issues are for them, so they think they're the only one with the problem. And so, like the statistics are amazing. 1 in 5 men under 40 will have some sort of sexual dysfunction. By the time you hit 50, 1 in 3 men cannot get an erection without a medication. By the time you hit 60, 1 in 2 men can't. And by the time you hit 70, only 1 in 5 can. So the stats are incredible. And I always say to men, like, they'll come in and they'll be so ashamed that they've got erectile dysfunction or premature ejaculation. And I'll say, you're a 50-year-old guy, next time you're out with your mates, every third one of them has the same problem as you. And they'll go, no, we've all talked about sex, it's all fine. And I'm like, no, you don't. You don't really talk about sex. Whereas women do. We tell each other, God, my vagina's dry, what are you doing? And they'll, whereas men don't do that.
No, I don't. Yeah, I don't think they do. It's not a conversation I've had with.
No. So I think that young men should get taught this stuff in sex education at school. Like if you want to have a healthy penis and you want all of these things, then you should be getting a strong pelvic floor now because it's going to improve your orgasm and that's going to set them up.
What do you mean school? Like high school?
Yeah, like we teach kids at school is sexually transmitted diseases and pregnancy, but we could be teaching them about like preparing their body for their sexual health through the lifespan. And that, there's nothing to be ashamed of if it doesn't work because it doesn't work for lots of people and there's help available.
I can imagine the trauma for if a teenager around that age is having problems already, they would definitely think they're the only ones.
Yeah, definitely.
And then that could be traumatic for them and throughout life. So,
I mean, we see lots of young men. Like I've seen a guy recently who was born with a congenital issue where when he gets an erection, his penis is curved downwards and he's 21 and he had not had sex because he said he had the opportunity, but he was so embarrassed because he knew that wasn't the way that it should look and he'd been too embarrassed to get help. And it's just a congenital problem and he's having surgery in a couple of months now and it'll be fixed. And, when COVID was on particularly, we saw so many young men with erectile dysfunction from having COVID.
Oh, really?
Because it caused inflammation in the blood flow to the penis and they'd get ED and then, we would have to help them with that. Yeah.
Oh, really? So the COVID, the sickness, it wasn't?
The sickness. No, it wasn't the immunisation. It was the sickness we were seeing people in.
Oh, wow.
Yeah.
Yeah, that's interesting. I never knew.
Yeah,
never heard
there's
of
a lot of worldwide stats on that. And because we were later getting COVID than the rest of the world, like when I was first seeing it come through, I was ringing up my colleagues in England going, you guys have got heaps of this. Are you seeing it? And they're like, yep, we're seeing it too.
Wow. Wow, that's something I've never heard of. How do hormones like oxytocin, dopamine and testosterone influence sexual desire and like bonding and the whole parts of the
So the dopamine is the hormone that makes us feel, happy and get excited and feel good. And so dopamine, oxytocin are released when we have an orgasm. That's why you get that happy afterglow. Oxytocin is also the hormone that's released when a woman breastfeeds. So it's the love hormone. You can have a baby that's got you up all night screaming and then as soon as you start breastfeeding it, you love it anyway. That's, nature's way of dealing with it. And, we get oxytocin and we get that afterglow when we have an orgasm when we've been with another person and we get it on our own as well. But probably, I think I've read one paper that says you get more of a release of oxytocin if you're with someone. But, we get that because then we want to go back again and then we're going to procreate more. So, procreate more. So I think that's the reason there. But testosterone, there's a lot of misconceptions, I think, about testosterone. And testosterone is important for desire and it is not as important as people think for erectile function. So it's about your libido and your mood. It's not so much about erectile function. And so often people will come in and think, oh, I need my testosterone checked. It must be low because my penis isn't working. But it's nothing to do with their testosterone. It's to do with all these other things.
Interesting, because I know quite a few people that take supplements of testosterone, and they come out saying that, they're getting morning wood and all that kind of thing, and saying it's increased this and it's increased that. And so that's all a misconception.
Yeah, I mean, it certainly does improve it a little bit, but not much. I'm really, testosterone is my big thing at the moment because I'm seeing increasing numbers of young men come through that have been buying it at the gym or on the black market, and then they decide, it's too expensive, they want to get it legally, so they book in, and then they'll come and they don't realise. Like I saw a 28-year-old last week and he's infertile, and that taking testosterone supplements when you don't need them has a very high risk of making you infertile.
Oh, he got made infertile from it.
Because he'd been doing it for a year, and the only reason he came in was because he's recently got married and they were thinking about starting a family, and his wife said, oh, look, you need to go and find out how all this testosterone has been affecting it. And I said to him, how long have you been taking it? It's like a year. And I sent him for a sperm analysis and semen analysis, and he's infertile. And I think
I did a podcast with a toxicologist, and we spoke a lot about testosterone, and there's a lot of other things that.
Oh, it's terrible.
Yeah,
it's a great hormone if you need it and if you're not producing it, but it's a really dangerous hormone to just give. And also there's also a gym junkie misconception that if you take HCG with it, that it's going to save your fertility, but there's zero evidence for that.
A lot of so many different all these supplements and things are coming out. Especially that gym culture, like it's such a strong, big culture that's like going up. Like then there's going to be a lot of effects of like people like this.
Oh, it's terrible. And there's a lot of really dodgy
and fake science. So that's what I was getting to. There's a lot of fake science.
A lot, and there's a lot of dodgy clinics that I think guys go to and will go. You can order your own blood test online, and then when you get your blood tested for testosterone, it should be a low spectrometry. Well, it has to be done before 9 a.m. for it to be accurate. You really should be fasting. So if you go and get your blood tested testosterone in the afternoon, everyone will look like they have low testosterone, but they don't. And then so people can order their own blood tests for this stuff online now, and then they go to some dodgy clinic. There's quite a few of them online that I won't name that are actually run by doctors, and they'll just go, oh yeah, it's low, and prescribe them testosterone. Those, there's so many medical professionals have been struck off for this, and then down that you've been paying $3,000-$4,000 to have it delivered to your front door a year, and then suddenly you find out at 28, 30 that you're infertile, and that has never been told to you. So that could be just soul destroying. Absolutely. And I'm seeing a guy at the moment that I'm trying to get off the testosterone, and he's in his early 30s. And, if you're used to like operating at a really high level of testosterone, coming down to what is a normal level is quite difficult. And so he feels really depressed, and he hasn't got his motivation to go to the gym anymore. And, so we're having to deal with all of these issues so that we can try and keep him off, because he actually isn't infertile yet, but he has a really low sperm count. And so we're hoping that he will bounce back.
Right. Damn. What do you think about porn and the impact of sexual expectations? On sexual expectations.
I'm not anti-porn at all. I think the only problem I have with porn is that the penises and the vulvas that you see in porn are like one end of the bell curve. And I think then, often a heterosexual man has never seen an erect penis except his own. A gay guy, different. They see them, so they know there's all different shapes and sizes. So if the only erect penises you ever see are on porn, then every man thinks he has a small penis. But he doesn't, because, only the ones with big ones get picked to be porn stars. So I think, as far as I'm concerned, that's the biggest issue. And also, if you're always getting your sexual gratification by watching porn, then you're usually masturbating with a hand, and then no vagina or anus is ever going to be as firm grip as a hand. So then you may develop a problem where you can't have an orgasm if you're with a partner. because you've got this thing called the death grip. So then we have to train people out of that.
Really?
Yeah. So if anyone's listening and you are masturbating with porn, then I really encourage you to use a sex toy, like I don't know a polite way of calling it, like a palm pussy or something, because you don't want to be really gripping the shaft of the penis tight with your hand, because nothing you're ever going to penetrate in another human being is going to be that tight.
Interesting. So does that mean
one of those to show you as well?
Yeah, I've never seen any.
So this isn't. I'm not really keen on palm pussies. I think they're kind of horrible, really. But this is probably one of our best sellers because I've got an online sex shop.
Okay.
It's called a Pulse Duo, and it's got this little plate in here that you might be able to see.
Yeah.
And that vibrates. So the most sensitive part of the penis is the frenulum, which is just under the head on the underside. Mm-hmm. And that goes on there, and you press the button and it vibrates on there, and then you can put lube in it and then you use it to masturbate. But you can't grip tight. So it's not training your penis to only respond to that tight grip.
Right.
And
so I don't know how to describe the look of that tool, because it's not it's not fully rounded.
It's like an egg.
Yeah, it's sort of egg shape. And then the top of it's kind of open with two smaller sort of flaps that go over the top.
And it also has it has a control on one side for the penis owner to control, and on the other, if you want to use it with a partner, they get a little remote control.
Yeah,
and it
seems to be quite common. That
and it has another underneath side. It has another motor, so you could put that on top of your partner, and that would vibrate on them. So this is also a fantastic toy for flaccid penises, so that they can have an orgasm, your partner can have an orgasm, and you can still have skin on skin and all that intimacy, but you're not relying on an erection.
Right. Okay. Does that mean you can masturbate too much?
Yes, if you're using your hand, yeah.
Yeah, right. Is there like a certain limit that's like too much to too less? Like, is there a recommended?
No.
Should it because you hear all these crazy things like, oh, male should be masturbating once a day.
Yeah, no, there's nothing.
There's nothing.
No, it's important that you get an erection at least once to 5 times a day, but that if you're healthy, that should just be happening anyway.
Right, okay.
But yes, no, you don't have to masturbate every day, but, it's a good excuse, I suppose.
Well, it's always like, because you hear it in the movies. I think I might have even been Wolf of Wall Street, where they talked about, I can't remember what they said in the movie, but about a certain amount, and then you hear all these people saying, oh, you need to be doing this once a day, and there's nothing to do. No,
but I think there's definitely no science behind that. I think, I have no problem with people having solo sex. And, I think if you look at countries like the Netherlands and Norway, they actually talk to their kids in high school when they teach sex education about pleasure and self-pleasure and solo sex. And they have the lowest teenage pregnancy rates in the world. And that's because, if you're on a diet, you don't go shopping because you've got to go down the trolley, the aisle with chocolate in, and you want to buy it. You make bad choices. So, if you're a really horny teenager and you're not self-pleasuring, then you're going to make bad choices when you go out. So I think, solo sex is great. So I don't think it's a bad thing. I just think we need to be careful about the way we do it.
A lot of men talk about the clarity after.
Yeah.
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 You mentioned earlier about porn and penis size. Does penis size matter?
Well, I'm a heterosexual female, so no, because, honestly, the women that are with the men that I see will say the best thing that ever happened to their sex life is that they developed erectile dysfunction for a while because they've had to experiment and do other things, and they've had to be less penis focused. And, only 1 in 20 women will have an orgasm from penetrative sex alone. So
1 in 20.
So you actually do need to understand about clitoral stimulation. So, yeah. Penis size, no, I don't think it matters at all. I think it matters, and some women will disagree with me, but I don't think most would think, I don't think penis size matters at all.
Right. Is there an average penis size?
Yeah, so there's actually, if anyone wants to Google it, there's a world map of penis size.
Like different countries?
Different countries, and I think that used to be much more relevant before we were so multicultural around the world, but now we're so intermixed, whereas back in the 70s, 80s, there was less transition of people, but that's probably less relevant now. But it is true that, African men have longer penises than non-African men, and Asian men on average have smaller length. And
there would be a natural selection reason for that. I am not aware of it.
No, me neither.
Through evolution, there's obviously a reason. If anyone knows, please let us know if they have
the largest penis I've ever seen, and I have to say not much shocks me anymore, but I saw a Sudanese man as a patient a couple of years ago now, and he had the largest penis I've ever seen, and he was like over 7 foot tall, and I was really worrying about his partner. Like, I had to say to him, is your partner from the same group of people? And it turns out that if you look up the Beginner's Book of Records, the particular area he's from do have the biggest penises in the world, and like, it was really large.
There was a TV show online that talked about the struggles of people with large penises.
Oh yes, I've heard about it. I have not seen that.
I can't remember what it was called, but it was a very eye-opening TV show, or documentary, because it talks about like a lot of these people, like their lives are completely like impacted by it. Like people are losing their jobs because you can't hide it even it's flaccid. There was this like guy, I think he was like 5'8" or something, and he had this super long penis. And like he lost his job because like it would bounce in his trousers. And people thought that he just was walking around the office with an erection. And so he lost like 2 jobs or something in that. And then there was the opposite case where like people were selling the idea of like, oh, I've got a massive penis, and then becoming in a way porn stars from that way. So there was like different.
Yeah, I've only can think of 2 men in the last 10 years that have said that like they've lost partners because they have really large penises, and it's quite distressing for them. So I suppose that can be a problem. But I do see a lot of men who come in that are from other cultures that are living in Australia, and they're going home to have an arranged marriage, and they're very nervous because the only erect penises they've seen online, I'd say at least 1 man a month like this, are much bigger than theirs, and they're really concerned about that. And so I have a book called Bared that has photos of 100 men's penises and their stories about their relationship with their penis, and often I'll just spend the consult sitting down with them going, have you seen anyone else's penis erect? Nope. And I was like, okay, well, let's have a look at this. This is what's normal. You're only seeing porn. So you think you're not normal when you are.
Right. Okay. Yeah, it's schoolyard. You hear all the boys talk about it in a jokingly manner. Like it's a joke that for no matter what age you are, if it's something that males talk about.
Have you heard about growers and showers?
Yes.
Yes. So most people are growers, very few are showers. So, you might feel as though you have a very small penis because your mate in the change room is a shower, but really when his gets hard, it doesn't get any bigger, and when yours does, it does.
Right. Interesting. Yeah. Yeah. Very commonly hear that. What do people often get wrong about libido, desire, and arousal?
Well, they're different things. Your libido is kind of like it wanting, you just thinking about sex randomly, sort of spontaneously. Desire is more when, you see something that or a person or a thing or something that actually turns you on, where you feel desire to be closer and intimate with that. And then your arousal is your physical reaction to that when you're with the other person. But I think the biggest thing about libido is that probably the biggest thing I see with libido is men will often tell me when they've been in a relationship with a female for some time, they don't initiate sex anymore, and particularly women over 40, like they just don't even, and the man still has this spontaneous libido. And I think that's because women's libido often changes with age from being spontaneous to responsive. So a man will just be hanging out if he has normal testosterone levels and just go, wow, I feel like sex for whatever reason. And whereas most women past a certain age, or when they've been in a longer term relationship, they don't just think of it. It just doesn't come into our head. So it's more responsive desire. So if our partner or someone is nice to us, or if we meet someone who, we go, wow, we desire them, then we'll have responsive desire, which is very different to spontaneous. So I think that creates a lot of relationship problems. And I think men need to understand that so that they don't think that their partner doesn't find them attractive anymore. It's not popping into their head. We don't have the same libido triggers as you do. We often need someone to trigger it for us, and then we'll go, oh, that'd be nice.
What about stress? Is that because you're talking about a lot of people that are in older age, but what about younger people? Like they go through, I'm sure they'll be going through similar things. And stress is probably the main thing. Like we're all driven to work hard as we can and do all these things. Does that have a big impact? Big impact.
So stress reduces your testosterone levels. If you're stressed, you're usually not sleeping very well.
For females too?
Yeah. And women have testosterone as well, and that's what drives our libido. And so, either of us, if we're stressed and we're not sleeping well, or if we've got sleep apnea or any of those things, then our testosterone levels will drop and our libidos will drop with that.
What about what are they called? Where females get they get the bar, they get the marina, they get all these different ways to not have babies.
Yeah.
Does that affect it at all?
So there is quite a bit of research about the contraceptive pill, the combined contraceptive pill of estrogen and progesterone together, changing actually who we feel attracted to, because it changes our hormonal profile. So if a woman who isn't on any contraception will desire often different types of men in the different times of their cycle. So they've done studies on this.
What's different types of men? Sorry.
So there's men who have, they've done it with facial recognition. They've got women in certain stages of their cycle and they've given faces about which ones they feel more attracted to. And when we're in our fertile phase, we're more attracted to men with more masculine jawlines and things like that. When we're in I can't remember the exact stages, but you can look the papers up. There's lots of them. But there's one recently that came out, was really interesting, and if you're in a different stage of your cycle where you're not fertile, you might be more attracted to a man who looks a little bit more feminine.
Does it ever go to the phase that they might start becoming lesbian?
Not that I've read, but maybe it does. I don't know.
Right.
But yeah, contraception definitely, hormonal contraception. But the papers I've read are all about combined. So when you're using something like an Implanon, which is the progesterone only in your arm, or a Mirena or a Kylie, which is an IUD, progesterone only is less likely to affect it.
Right. What about the other two? Or the IUD?
Oh, yeah. So that's what I mean. Yeah, the IUD is a Mirena or a Kylie.
Oh, so they don't affect it at all?
Not as much because they're progesterone only. It's the estrogen that affects it more.
Right. Interesting.
In the combined pill. So when I see young women, I always try and transition them to progesterone only.
Yeah. Yeah. What's the most common question you get asked in your practice?
Probably, is my penis a normal size?
Oh, really? Yeah.
So
that's probably the first thing that's on most males' mind.
Even surprisingly, the young guys, and we see lots of young guys in our clinic, they will usually with premature ejaculation or erectile dysfunction, and often because they think testosterone's the issue. But the young guys often will ask that question, but it's surprising how many men in their 70s and 80s will get to know you over seeing you regularly for a year, and then one day they'll be a bit cheeky and go, I've always wanted to know, is my penis normal?
Right. Yeah, interesting.
Do you see a lot of penises? Is this normal?
What does a healthy sex life even mean? What does it look like? You should be having sex so and so amount of times, or I guess it would be different to if you've got a partner to if you're single. Mm-hmm. If in a relationship, should there be a certain amount of time you should be having sex, or is that all psychological and each relationship's different? I think
it's all independent to every relationship, but I think the biggest problem is when you have mismatched libidos. So very rarely are you going to meet a partner that, you like doing the same things, that you have the same sense of humour and you've got the same level of libido. And in the same-sex relationships and the heterosexual relationships I see, there is always an issue of mismatched libido. And so I think whatever is right for you, I interviewed a couple for my podcast the other day who are in their 80s and they have sex 5 mornings a week and have done for 50 years. That's unusual. Not many couples, even young couples don't do that. And it waxes and wanes. When you first meet someone, you're really hot for them and it's really exciting and you'll be doing it all the time. And then later on you might have a baby together and then you're tired and, your work's stressful. So I think it waxes and wanes. I think the most important thing is that you just don't get into a rut of never being intimate with each other, because it's way more awkward to reinstigate a sexual relationship with somebody that you've had it with before than it is to find a new partner. And I think it's very easy to get comfortable and go, oh, we haven't had sex for months and how did that happen? And so I think it's important that you do keep some tab on it and make sure that even if you're not having sex, that you're at least cuddling up and you're having skin on skin and you're being close to each other. But there is no limit of what's right and what's wrong. I think it's about the couple, and I think it's just about talking about it, and also being open that if you would like to have an orgasm, for instance, 5 times a week and your partner only wants it 1 time, then don't shame your other person if they want to have solo sex or self-pleasure. So.
Is that one of the most important parts of a relationship? Or is this more of a psychological question, isn't it?
No, I definitely deal with that stuff all the time. Yeah, it was just the sexual trauma I don't do much of. But no, definitely. Communication is the biggest bit. If you have a partner, I used to say to my kids when they were teenagers, never have sex with someone you can't fart in front of. Because if you can't fart in front of them, you don't feel comfortable enough with them.
Interesting.
And I know that's a really simple view.
I've never heard that, but that's like a great way of explaining it.
Yeah, I've never heard anyone else say it either, but it was just my very immature way of explaining that you need to be with someone you feel comfortable and confident with and that you can communicate with. And it was my way of explaining that to teenagers.
Yeah. I think that's a great way to get through to teenagers as well. I know you did mention just about the trauma thing, but that would have a big impact on people.
Very big impact. I mean, there is no denying that what happened to you when you were younger or when you're older, and having sexual trauma definitely changes the way your sex life and the imprint of your subconscious view of sex and all of those things. But yeah, it's just not an area. If I have someone in that we always ask about sexual trauma, and often people won't tell you at the beginning, and then when they've got to know you, they'll disclose that down the track. And so I certainly talk to people about it, but that's not my area of specialty. So I would send them then to a psychologist, sexologist that is specialised in that area.
Right. I see a lot of these days, like the different drugs, like I think Pilot is one and all these. Is there do they work? And or they're sort of like people jumping on this bandwagon of?
So I have a problem with that, because the thing that I have is that Pilot and Mosh, and there's quite a lot of companies like that. And I have a telehealth platform. People don't have to come into my clinic. So I see telehealth people from all around the world, and I have 3 other practitioners that work with me, and we see people in telehealth. But my problem is you should not be able to go online, answer a quiz of 5 questions, and then have a text message or an email sent, oh, yes, you've got erectile dysfunction. We'll send you an exorbitant price delivered to your door in a brown package, Viagra. Because that's the drugs these companies are offering are the same ones that you get from Chemist Warehouse for $20.
Right.
They're not different.
Yeah.
And also, having erectile dysfunction can be a really big sign that you've actually got cardiovascular disease, or you've got diabetes, or you're having a reaction to a medication you've been prescribed. So if you're not having a proper health assessment, like a holistic health assessment, and you're just putting a Band-Aid on it by, if you've got a blocked artery to your heart, you are not going to have good erections. So if you just go onto one of those websites and you get sent Viagra to your front door, you could be taking that for 3 years and then drop dead of a heart attack. Whereas if you had have gone and seen someone about this, they would have gone, hang on, this is a red flag. We'll help you with your erections, but it's a red flag that you might have heart problems, and we will do a thorough cardiovascular assessment and send them off into a cardiologist if we're worried. And so we'll help with the erections, but at the same time, we'll make sure they don't drop dead in 2 or 3 years from a heart attack. So I feel really bothered about those models, and I don't think that anybody should be prescribed any medication for their sexual function unless they've had a full, proper workup.
Going back to the podcast I did with the toxicologist with Garth, he was talking about how there's so many dangers with people buying all their medication and everything online now because it's so accessible, it's so easy. Then so many people having these huge problems, and a lot of people even dying,
of course,
from all this. And like he was talking about like all these high levels of even like lead, zinc, cadmium, all the arsenic in the supplements that they can just buy at not chemists but like online or or supplement stores, and like it's so accessible, but people just aren't aware, and they're like, oh, they think they know everything, and people are so good at advertising these days as well, and they put that out, and
they say, oh, it's a qualified health professional that's writing the prescription, and it is. But if that qualified health professional isn't speaking to you, at least on a phone call or looking at you on a Zoom call and making sure that they've got whatever other medications you're on, whatever else is going on in your lifestyle, and all of that, how do you, like if you give someone Viagra that's on a family of drugs called nitrites, that can instantly stop your heart.
Right.
And so, when someone's filling out a quiz, are they really disclosing what medication they're taking properly? Whereas when you're looking at someone in the eye with a telehealth consultation, you can tell
if they're lying. Yeah. You mentioned earlier about like fitness and like unhealthy people. That obviously has a huge impact on.
Massive. So the easiest way I explain this is if you are trying to water your lawn and someone parks the car on the hose, you're not getting enough blood flow. You're not getting enough water to water your lawn. If you have a big fat belly, so if you have a belly circumference of over 94 centimetres, it is.
What if you're a really tall person? I guess that doesn't really change.
Never over 94, yeah. I mean, it could be a lot skinnier if you're a short person, but 94 is the, BMI I don't think really means much with this, but your belly circumference at your abdomen, at your belly button does. Then you're basically parking a car on the hose that is putting all the blood flow. And whether you're female, male or indeterminate gender, you need blood flow down there for it to work. So losing weight and being healthy and exercising, like sitting down all day, is the worst possible thing you can do for your sex life.
Is there certain types of exercises that is better, like going to the gym or running or cycling, swimming? Like, is it certain?
Just getting the blood pumping is the most important thing. Cycling's interesting because cycling is great for your cardiovascular system and getting blood moving, but you need to be careful. Like if you just cycle, a few times a week, it's fine. But these guys, the mammals in there that are on their bikes for a couple of 100 Ks, you'll often get them in with erectile dysfunction because the bike seat is on the perineum or the gooch and it's squashing the nerves that are giving you an erection. So they'll get numbness and change in sensitivity of their erections and they won't have as good erections. So if you're someone who spends a lot of time on a bike, then you really should have a split seat and wear padded pants.
Interesting. Right. I'm training for an Ironman. So lots of time on a bike. I did not know that.
You need to get a split seat.
Yeah, okay.
And wear padded pants.
Yeah, I do wear padded pants because the seats are so hard.
Yeah, the split seat is really important.
Yeah. Right. Okay. Thank you. Thank you so much for coming in today. This has been mind blowing. It's definitely, as we mentioned at the start, it's not a topic that's talked about too much at all. So being able to pick your brain and be able to, you opened up so many different areas of knowledge I've never ever heard about. So I'm hoping that for the listeners as well, that they get the same experience. And thank you for joining me today.
Great. Well, thank you for having me. And if anyone wants any of these other topics in more detail, then they could go to my YouTube, which is just my name, Melissa Hadley Barrett, or the podcast, which is The Penis Project.
Awesome.
Thank you. It's great.
Paramount importance.